Good afternoon, everyone. Welcome. We're so thrilled to have you here with us for today's webinar session, which is going to focus on violence reduction councils. My name is Sam Cook. I serve as the Director of Policy and Planning here at the Pennsylvania Commission on Crime and Delinquency. We're very thrilled to be partnering with Johns Hopkins Center for Gun Violence Solutions on today's webinar to highlight some of the research and resources that they've developed related to this model and approach. And it's a model and approach that is really central to some of the funding announcements that PCCD has recently released as part of our Violence Intervention and Prevention Grant Program. So if you haven't already, I encourage you to check out pccd.pa.gov, and you can see those solicitations and learn a little bit more about those funding opportunities. So with that, I'm going to turn things over to our presenter and expert for the day, Mallory O'Brien. She's an associate scientist in the Department of Health Policy and Management at Johns Hopkins Center for Gun Violence Solutions, and she'll be leading our presentation today. We're very thrilled to have Mallory and her expertise to share with you also. Mallory, without further ado, the floor is yours.
Thank you, Sam. It's really nice to be here with everybody. Really excited to share the work that we've been doing and give an overview of violence reduction councils and the tools that we've created for communities to develop violence reduction councils. At the core, a violence reduction council is really a way for communities to really think about collaborating and coordinating all of their violence prevention activities. It has a solid data component. So underpinning the work is a data infrastructure. There is lots of engagement with community-based organizations and government agencies. And there's a governance structure that's been created so that as ideas and recommendations are generated, there is a way to create action and implement those recommendations, new strategies for prevention and intervention. So with that high-level overview, I'm going to get started and talk a little bit in more detail about my colleague. So Cass Profasi, who some of you may know. Cass is she's an associate professor. She co-leads the Center for Gun Violence Solutions, and she and I worked on this together. In fact, I trained her many years ago in how to do this kind of work, and she was implementing a violence reduction council in a community in Virginia. So when we think about public health and public safety and community partnerships, those are really the core partnerships that we need to have in place to develop violence prevention efforts and to actually implement them. And why is it important to have each of the pillars in the room and part of the collaboration and coordination? It's important because each of these systems face the same shared challenges. And so having all in the room is very important. And think about what's going on in your community right now. Those cross-system collaborations are generally rare. We tend to stick to our silos. And the community often needs both health and safety as we think about reducing violence. And there are environmental, social, political factors that are perpetuating poor safety outcomes, and those also contribute to poor health outcomes. So getting everybody together is key. The challenge, though, when we think about public health, public safety, and community, is that oftentimes we speak a different language. So I come from a public health background, although I have worked closely with public safety for many years, but figuring out the language in the beginning was challenging. Public health and public safety track different outcomes. The community is interested in a similar but different outcomes. And as I mentioned earlier, we operate in silos. And so breaking down those silos, not only from a data perspective, but in a coordination and collaboration perspective is key for successful violence reduction strategies. Next slide. So I mentioned different language. So in public health, we think about the host, the agent, the environment, collecting information around those key components and thinking about how they're interacting together and how we might break the cycle at any one of the points in our triangle to reduce the outcome that we're thinking about. So in our case, you know, our host is our victim, our agent is our firearm oftentimes, and in the environment we have the location and thinking about gathering all that information. In our policing space and in our public safety space, there is the similar triangle, which is from the Center for Problem-Oriented Policing, and they use a very similar triangle. And so when speaking public health, public safety, you can see that as we think about how to approach the problem, we're coming from the same place, but we might be using a slightly different language. And next slide. And if you think about it one step further, and we think about the public health approach and the SARA model, which is the scanning, analysis, response, and assessment, you can see that here again, we are thinking along the same lines, but we're using a slightly different language. So on our public health side, we think about measuring. So what is the scope of our problem? Gathering data, identifying those risk and protective factors. And once we have that information, we think about developing and evaluating interventions, what's working. And when we determine what is working, we then scale up those interventions. Same thing, only said in slightly different words. We are scanning, so we're identifying the problem within our SARA model, analyzing the data, figuring out what's the problem, developing our response, and then evaluating the response strategy. And those are cycles. So we're continually going through those cycles to ever improve the work that we're doing. So next slide, please. So the framework that we've put together for a Violence Reduction Council builds on many practices that you may be familiar with. It brings together the best practices and lessons learned from jurisdictions across the country that have engaged in homicide reviews, shooting reviews, overdose fatality reviews, sentinel event reviews, critical incident reviews. So we've looked at all of those models. We've trained many jurisdictions on many of these models, and we've learned from that experience of what's working in the communities that are effectively implementing the framework. So the guiding principles of a Violence Reduction Council is the common goal of reducing firearm deaths and injuries. So we start from that preface that we have this common desire to reduce deaths and injuries from firearms. We believe that firearm injuries and deaths are preventable. And I know oftentimes folks think about the immediate event and they say, we don't know how we could have prevented this. But this process that we've put together, this framework, allows communities to look further upstream and think about what could we have done to have changed the outcome in these events that could have prevented the firearm injury or the death. So we believe that they are preventable. We also believe that we have to be responsible users of multi-sector data, and that data will inform our response strategies. And this is a continuous improvement cycle, so we're always trying to reflect on the work that we're doing, the work that we have done, and looking for opportunities to improve. And by using these principles, we're able to facilitate a deeper understanding of gun violence and the identification of missed opportunities for prevention and intervention that may have prevented a fatal or a non-fatal shooting. We're able to start to see patterns of needs and opportunities, not only within specific agencies, but across systems. And we're able to develop innovative program and policy recommendations to improve coordination and collaboration between agencies and improve community conditions to prevent future gun violence. And there's a shared responsibility and accountability to implement the recommendations that are identified. And so to do that, we use an SOS framework: shared understanding, optimized capacity, and shared accountability. And what does this mean? It means with our shared understanding that by using this framework, we're able to increase members' understanding of the area, agency roles, and services that are occurring in the community. What are our community assets? What are our needs? And how then can we better work together? Optimizing our capacity then, so that we can prevent future firearm deaths and injuries by leveraging the resources from multiple agencies and sectors to improve and increase our system level response. And that we have a shared accountability to continually monitor the local firearm injury and death data, as well as the recommendations that are being developed and implemented. And the status updates on these recommendations are shared at a multidisciplinary meeting with the governing committee, reinforcing the action and the accountability of that action. So if we think about then this SOS model, so we're getting a shared understanding of what are the efforts that are currently underway? What do the agencies that are working on the front lines really do? And how can we all work together better and optimize our capacity to improve outcomes in our communities? So let me now just switch gears a little bit, giving you a high-level overview. Let's talk a little bit about what does the structure look like of a violence reduction council. So there's going to be a lead agency, a high-level lead agency. There's a governing committee. There's a work group. There are review teams, and there are subcommittees. And these all come together then to form the Violence Reduction Council. Let's tease it apart a little bit. So you have a lead agency. The lead agency oversees the coordination and provides administrative support. There is a governing committee that comes together on a regular basis to support the development and implementation of the recommendations, but also ensures that the case reviews are occurring and the data is being shared. There's a work group that comes together that are mid-level folks from the agencies that are participating in the process to help guide the action of the review teams and help develop those action plans for recommendations. There are the review teams themselves that will really dive into the data. So the review teams have been set up in a bifurcated process. One is primarily consisting of criminal justice professionals, and the second is primarily community-based organizations. Obviously, for you to be successful in information sharing, you need to have people from every sector participating and agencies from every sector participating in this information sharing. So it's a way that we can do a series of case reviews on individuals that have been killed by a firearm and really dive into the meat of a case. You're starting with aggregate level data, so you can see locations, you can see types of homicides that are occurring, but you really need to bring all of the partners together to share information so that we can identify those system level issues and agency-specific issues that, had we done something differently, we could have prevented the homicide or the non-fatal shooting. And then once we get through and develop recommendations, there are subcommittees that will be formed. Either there could be ad hoc committees, or there may be long-standing committees that meet for a year or two, depending on the level of the recommendation. For example, if it's a legislative change, that is probably going to be a longer standing subcommittee than one that is trying to figure out how we can facilitate better information sharing, for example, around a particular issue. So you have a lead agency, a governing committee, a work group, review teams, and subcommittees. These entities, the lead agency generally is going to be a public health department or an office of violence prevention. The lead agency needs to be a neutral agency that has as part of its mission violence reduction. They need to be seen as a trusted entity within the community. The governing committee is going to meet quarterly to really review the aggregate level data, the findings from the case reviews, and the recommendations that are generated through the case reviews. The working group is probably going to meet monthly. And again, these are the folks at the mid-level that can ensure the reviews are occurring and give the overall review of the recommendations to see what's feasible, what's not, and how best to move forward with implementing the recommendation. The review teams are going to meet monthly. They're going to look at cases, depending on the process, either cases that are cleared cases or cases that are closed cases or open cases if it's only law enforcement, public safety. And then the subcommittees are going to meet as needed. And I think the other thing I would like to say about this is, depending on the size of your jurisdiction, you may not have this extensive framework: lead agency, governing committee, working group, review teams, and subcommittees. Depending on how large your jurisdiction is, it may be that the people that participate in your reviews are also mid-level. Smaller jurisdictions may have the chief of police and the CBI frontline folks meeting together in their review teams, in which case you may be able to consolidate this. Larger jurisdictions like Philadelphia, they're going to have to think about a larger framework. So the next slide. So I talked about multi-sector collaboration, and I alluded to some of the partners that you're going to be considering having part of this process. So clearly public health, Office of Violence Prevention, police, community-based organizations like the CVI organizations, domestic violence, advocacy groups, neighborhood level community-based organizations, prosecution, city county leadership, corrections, community corrections, judiciary, schools, housing, victim services. And there are others that you may want to bring to the table. Really thinking about having the right people in the room, having the right information coming is so important to successful conversations. Sometimes it means that you start out looking at high-level, aggregate-level data, and you then using that aggregate level data to understand where you should be focusing your case reviews, and then ensuring that you have the right people at the table to share information about the cases that you have identified for the case reviews. It's important that you have a champion or champions to help with multi-sector collaboration. Executive leadership engagement is important. And when you think about these multi-sector collaborations and who are your partners, it's also thinking about who are the individuals. So if you're doing a case review, you may want more frontline individuals that are on the street working with the individuals that are unfortunately our victims of gun violence. And then thinking about then at other levels within our framework, where you would bring in a mid-level and where you would bring in executive leadership. It's really key to have shared accountability, as I mentioned, but it's also really key to have a good facilitator. Facilitation is really important, that you have somebody who's neutral, facilitating the discussion, that they can engage all the partners, that they can ask the next question, and really get people to be sharing information as well as thinking about what could we have done, being the big we that could have changed the outcome for the particular case that's being reviewed. It's also important that there is timely and accurate data and information shared, that we are using the data that's provided and doing some translation and bringing action to the case reviews and the recommendations that are identified. Next slide, please. So we've created a toolkit for you, and that toolkit I have, there's a URL you can grab at the end of the presentation. And the toolkit is set up to provide you with the framework and the structure for a Violence Reduction Council. It talks about data and information sharing, building trust and accountability, how to develop solutions across sectors. We've created some evaluation tools. And we've created a Violence Reduction Council data system. One of the heavy lifts that communities have is when they're doing this kind of work is what kind of data should we be collecting and what should we be putting in and how do we use the data then? And so one of the things that we've created is a data system for use that is free, costs nothing. It's created in REDCap. And the data system provides various projects within the data system for you to enter all kinds of information. It is at the incident level, so if you have a non-fatal shooting and a homicide in the same incident, you're able to capture that information. And it allows you to go beyond those traditional data sources. Oftentimes communities are looking at primarily medical examiner coroner data and law enforcement data. And with the data system we've created, it allows you to capture all the information that would be shared in a case review with all of the partners that were mentioned on the prior slide. So there's information that's available from that prosecutors would share, the courts, corrections, touches that community-based organizations have had, and school information, as well as community context, and also a place for you to track your recommendations. So thinking about where you can document what you've determined at a case review, and then thinking about how you develop your action plan, and who's responsible. There's a place for you to capture all of that information. So for example, if your common council asks you, or your county government officials ask you, what are your recommendations? You got a quick, easy way to pull that information. And then finally, there's a guide that we've put together that's a PDF that you can download. There are also template documents for you to use on information sharing and sample emails. And we have a PowerPoint that isn't yet loaded, but a sample PowerPoint. So next slide, please. The modules that we have within the guide include what does the structure look like, building the Violence Reduction Council, forming partnerships across agencies and in the community, fostering involvement from communities disproportionately impacted by violence, planning your meetings, so getting into the nuts and bolts of what does a Violence Reduction Council meeting look like, some tips on facilitating, Violence Reduction Council meeting, collecting the data, and then building a recommendation plan. So what does that look like, and what's the cycle then that those recommendations go through? So we've tried to be as complete as we can. And I just want to end with, we get the question, well, does it work? And the answer is yes. So the initial work that I did in this space was in Milwaukee, and we built out the Milwaukee Homicide Review Commission, and we found which is the violence reduction councils are the next generation of homicide review commissions. And in the first iteration, we found we were fortunate that in the beginning of the process, we were only reviewing cases in 3 of the police districts. And so we were able to we had a quasi-experimental design, and we were able to determine that in the districts that were participating in the reviews, we saw a 52% decrease in the monthly counts of homicides compared to a 9.2 decrease in the other districts. We found that clearly it was working, and after we did this initial work, we expanded quickly to citywide case reviews. And we also use this in lots of other ways, but the process works. The key is following the fidelity of the model. The model, I will say, having said that though, it has been designed to work in your community. So we give you the bones and the framework, and then allow for each community and jurisdiction to tweak it as needed for the work that you all are trying to do. The last thing that I want to say is that this, I think, can seem to be a lot, and depending on where you want to start, I would recommend that you not try and develop a process for your entire city or your entire jurisdiction, but as we did, start out small. Think about doing creating a review process in a particular geographic area, and think about staging your reviews. And what I mean by that is maybe you start out with your community service provider review and then move to your criminal justice review, and take it step by step so that you're not trying to do everything at once, because everything at once can be overwhelming. So start small and build and build and build. And I think we have the tools for you, and we certainly want to be a resource for you. So if you want to go to, you can probably, well, you can look at the next slide. The next slide is just an excerpt from one of the interviews that we did when we completed the evaluation of the Milwaukee effort. And you can see that the participant credited this process of bringing everybody together really as a way that we improve the capacity for the community to work together and reduce gun violence. And then the last slide that I have for you is a link to the Violence Reduction Council framework and all of the tools that we've created. And I'm excited to see where you all go, and we are here to help. There is a request for TA if you look at the website, and we'll do what we can to assist. So thank you for taking the time and listening today, and I hope what I was able to share was helpful.
Thanks so much, Mallory, and thanks so much, everyone. Have a good rest of the day and a great weekend.